when Ontarians and cancer fighters are looking to their government, they are looking for decisions of healthcare that have to do with, that are honest, that have integrity, and that are transparent. Our investigation disclosed that there is 3 critical blows to the government's credibility, and the Ministry of Health's credibility. The first one is when Avastin was announced, trumpeted out there last year. There was not even a footnote, no small print, that there would be a 16-cycle cap. First blow. The second blow, and this is what I call the big wet blanket. When someone challenges the 16 cycles, the bureaucrats at the Ministry of Health throw the big wet blanket of clinical, scientific studies that back up their claim that you only need 16 cycles. Well, guess what? There is no such clinical scientific data. It sounds very intimidating to be told that. And if I was the Minister of Health Long-Term Care, I would say, show me the money. Show me those clinical scientific research data that you're relying on. It's all a figment of the bureaucracy's imagination. It's all an issue of cost containment. The third blow is that we're told, hey, this is an issue that could spiral out of control as well. An issue of funding and money, and in this current climate, we got to be very selective in how we spend taxpayers' money. Well, interestingly, the ministry has not monitored at all how it has funded this area. They can't tell us exactly how much was spent since the treatment started in 2008. So if it's such a preoccupation, then keep tabs on it. So if you look at the totality of these 3 blows on the credibility of the Ministry of Health Long-Term Care, and if you're the minister or cabinet or the premier, you'd be scared off. And I don't think I can take issue with that, but we need to pin down the issue and deal with it. This is not about the great boogeyman of finances spiraling out of control. It's not the great boogeyman that's going to jump through the floodgates and bankrupt the province. 14% of cancer patients make it to the 16 cycles. We estimate that that would cost about $9 million. Now, the new drug fund has a reserve of $3.8 billion out of a $40 billion health budget.
Just to understand it correctly, you estimate $9 million to fund this in the way you suggest?
Yes. Yes. When we look at how the other provinces do it, 7 provinces have this approved in one way or another. Ontario is the only one that has this hard cap.
In the times of the essence, this compassionate review policy, is it your concern that people will die trying to get through yet another bureaucratic process waiting for funding for the
Absolutely, absolutely. That's why we rejected. I mean, when we were proposed this compassionate review policy, we had to look at it again and said, well, maybe that'll resolve it. We exchanged scenarios with the ministry because I think the ministry right now has a credibility problem. And we're not going to get snowed by some fancily labeled compassionate review policy. And we discovered that there are a lot of weasel words in that compassionate review policy. And when you pin it down, it's just not a compassionate policy. It's a bit of an oxymoron. You know, I think the system, for example, in BC is a lot more logical. There's a soft cap. So if you can demonstrate on an ongoing basis after a certain amount of treatments that it's working, it's automatically approved. Here, it will make no difference in the lives of these cancer patients. We're not going to be part of some charade pretending this is the solution.
Comment réagissez-vous au fait que le ministre de la Santé avait prévu une conférence de presse tout de suite après la vôtre, là, à 14 h, puis finalement, ça a été annulé? Comment interprétez-vous ça, cette décision-là?
Écoutez, j'ai aucune idée. Il faudrait demander au ministre lui-même.
Est-ce que ça fait partie de toute la stratégie du gouvernement pour se sauver de ce sujet-là?
J'ai aucune idée. Moi, j'espère bien que le ministre a quand même gardé une ouverture d'esprit qui lui permettrait d'accepter et de mettre en vigueur nos recommandations. I hope that the minister has kept an open mind. As I said, if I was Minister of Health and Long-Term Care, and I know it's a very, very difficult job. I have a lot of respect for anyone who accepts that portfolio. It's a difficult job, but I would look straight in the eye of my public servants and ask, you've said that there are clinical scientific studies that back up the 16-cycle treatment. Show them to me. And he will see that he will get the same blank stare we got. Thank you very much. Yes?
Is there evidence that cutting a patient off at 16 cycles actually does harm?
Well, yes, there is actually suggestions by oncologists that in some cases it may actually cause a rebound effect and make your cancer worse than it was before the treatment.
Isn't that against the Hippocratic oath for a physician?
I'm not an expert on that. I can just tell you that's definitely wrong. It's not only you're offering false hope, but you may actually be causing more harm than good by cutting someone off. Thank you very much.